Speak now to Dr. Chan Nagpal, BMA Council Chair, who gave evidence to the Committee of MPs investigating this. Dr. Nagpal, good to speak to you again. Thank you very much for being with us on BBC News. You won't be surprised by the findings of this investigation since you helped to contribute to them. But I mean, the serious question is, what can be done in the short term for a problem that is tied in part to long-term trends, including a failure to recruit enough staff over many years?
Sure, you're absolutely right. We need short-term action and also longer-term planning. But as we speak, I just want to highlight the scale of the problem. That we were about 8,500 doctors short when we entered the pandemic, unfilled vacancies. Most doctors have experienced the most traumatic year and a bit of their lives as a medical profession. They've seen deaths, they've seen illness at levels they've never been trained to. They've had to be holding smartphones at the end of the bed of patients communicating with their loved ones because no visitors were allowed in hospital. For GPs, they've been vaccinating patients on top of their normal duties. They've actually not had annual leave in the way that others have had because they've had to fulfill their duty of care to the population during a global crisis. Many have not had breaks during their work. Many are working in roles that they've not previously been trained to do because they were helping out in critical care. So it has been a hugely traumatizing year, and they are exhausted. When we had the lockdown, doctors did not have the opportunity to stay at home. They've been working harder during the lockdown because that's when the illness was at its highest. So what we really need to do is recognize this reality and invest and support the workforce to have proper rest.
That's really interesting, because to have proper rest means you have to fill in behind to create the capacity for that, doesn't it? And that is, again, a problem because, I mean, lots of health authorities, health trusts rather, have been trying to reduce their reliance. In fact, the government has required them to reduce their reliance on agency staff because of the additional costs involved in using agency staff. At the same time, presumably some people who are currently in the service might, after this stressful year, decide I've had enough. I mean, I just wonder, what are the things you can do in those circumstances to try and obviously make people feel valued? That's important, sure, but also give them some kind of respite that then means they'll come back and give it another go rather than just walking away or being forced to walk away because their health collapses.
Yeah, well, let me tell you, our own statistics, and these are very worrying, show that about a fifth of doctors intend to walk away once the pandemic eases down. About a third are intending to take early retirement, and 50% are going to reduce their hours. Now, if that happens, it would be catastrophic for our health service at a time when we are facing the biggest backlog of care we've ever known. So you're absolutely right. The most important thing is that doctors, like anyone else, do need some rest. Those that haven't taken leave need to recharge their batteries, but because we're going to have a very long future of challenge ahead of us as we try and recover. What we can do, 40% of doctors say they don't even have facilities in their hospital for rest. So we need to create those facilities. We need to make well-being much more integral to our health service, so that when managers and the government have initiatives, they think first and foremost, what is the impact on the well-being of staff? It's better to have doctors who are able, capable, feeling positive, feeling energized, than having an exhausted workforce that doesn't deliver because they just can't.
Yeah, I'm sorry to interrupt. I'm very interested in the point you're making, because we've talked actually here on BBC News in previous weeks about some initiatives that have been done in hospitals to create spaces where people can go and kind of almost kind of let out an inner scream and just get the tension out. And when it's helped with their mental well-being, it's helped to them kind of gird their loins and go back in for the next session of work. But so those are all things that can be done sort of at a local level and can be made very effective. Looking if we can pull out from that at the bigger picture for government. I mean, we heard the former Health Secretary, Jeremy Hunt, who actually chairs this committee, saying, look, you know, I accept my share of responsibility when I was in charge of the health service, but I did create these new extra posts. It's just that because of the 7-year delay, because you've got to train people, none of those people have yet started in the NHS. There is an issue here, isn't there, about the way the NHS plans its workforce. What needs to change?
Well, first of all, we need to plan, because we haven't been planning. And the way in which we entered the pandemic highlights that, you shouldn't have a health service that has 80,000 vacancies. There has been no explicit plan on what the workforce requirements are for the scale of care that the NHS has to deliver. And this is what the report is asking for, is clarity. And once you're clear about the workforce requirements, you then have to have a clear commitment with plans on how you're going to fill it. What we've seen in the NHS is we've just stumbled along with an inadequate workforce, with no decisive commitments with workforce in workforce planning, with numbers, etc. We've said we'll have more medical students, etc. But that hasn't been in the context of really looking at what the service requires and what we need to, when the numbers needed to achieve that. But I also don't want to lose sight of the immediate danger we have, that if we lose a fifth of our doctors because they're exhausted, which is what our surveys tell us, and if large numbers of them reduce their hours or have take early retirement, that will actually be devastating for our service in the next year. So you're absolutely right. We need to have proper planning. The report has called for that. And we need to have the investment in well-being being probably one of the biggest drivers of how we actually staff our NHS. At the moment, we've only sort of thought about, having staff to provide a service. What we need to think about is making sure that those staff have proper rest, they're valued, they're respected, they're given recognition for their efforts, and all of those factors, and actually working in a safe environment. We know that the NHS has for far too long relied on unsafe levels of staffing, which is why we're calling for safe staffing levels. Now, once you become explicit about what safe staffing is, once you become explicit about what's needed, there's every chance then of actually having a plan that will deliver a workforce for the future. So we have to see those bits of explicit commitments.
Dr. Chan Nagpal of the BMA, thank you very much.